BCORE stands for Broomfield Co-Responder. A co-responder is essentially a licensed mental health clinician. We are responding in the community with officers. We are providing real-time support for our community members. We're really able to meet people where they are, so we can provide mental health support, resources, really anything that individual is requesting.
The police officers are the experts with law, and we're the experts of mental health and assessing mental health. So for us to be able to come together and collaborate on scene to help the community, it just makes a big difference. And it helps us meet the individual where they're at and get them what they need.
Helping people navigate through these situations where maybe they've been through it before, but maybe this is the worst day of their life and the worst day of their loved ones' lives, and they could really use help with understanding kind of what the process is going to be.
We do not carry a gun. We are not sworn officers. We are simply trained mental health professionals. We're really meeting with them in that moment that they're calling out for support. And then we work with them to find connection. So it may be a couple of follow-up conversations after the call. If it's connecting them to a long-term therapist, we're gonna find all those resources to make sure they get that connection before we close that out. And if it's something that needs to happen more in real time, maybe a walk-in crisis center, we'll make sure that they are able to get there successfully. So we're really the triage that ensures that connection long-term. We're trying to mitigate people falling through the cracks. And I think it breaks down those barriers of historical trauma of wanting to call 911. So now when you call 911, you know if it's a mental health crisis, a mental health professional can accompany those officers. So the officers can handle what they're experts in, and the mental health professionals can handle what they're experts in.
I'm a licensed mental health clinician, so I have my LCSW, and the last 10 years I've been working as a social worker in the field. I've always just enjoyed the crisis work and helping people.
I am a licensed clinical social worker and a licensed addiction counselor. Those are two different licensures that I had to obtain after my master's degree.
There was a gentleman that kept calling 911 over and over again. There was no crime happening, there was no need for law enforcement, but they continued to have to go out over and over again. And he was in crisis related to addiction and related to mental health. But eventually I was able to get in touch with him, just start building rapport with him kind of, and convince him, instead of calling 911, just call BCORE or just text me and we can talk, whatever that looks like. Fast forward a couple weeks, he's texting us saying, I got into a local hospital, they put me through a detox, they got me connected to resources. Thank you for your life-saving work.
I think that everybody struggles with the impact of mental health in some way, whether it's them personally or somebody in their family or a friend. Mental health impacts everyone differently, and so I think having this resource in the community is very important. Being able to go out to meet people where they're at makes a big difference.
There's a couple of ways you can get a hold of the team. One, call into dispatch with whatever's going on, give as much information as possible, and you can actually request BCORE or a co-responder to dispatch. The other way that you could do that, especially if it's just for a follow-up, maybe it's not an imminent crisis, you just want to reach out for support, you can call our general line, and that number is 983-888-6700.